Assalamu alaikum. I'm Dr. Asif Nawaz, Junior Surgical Resident and the lecturer of anatomy. In the previous class, I already discussed about the liver and their functions, anatomy, and divisions. Now, the main excretory functions of the liver is biliary system. Bile, that is very much common. You all know that it is an important enzyme which will make the fat globule into small particles, which is called the emulsifications, and the secretion of bile is the one of the important excretory functions of the liver. Here we will know from which cells from the bile is produced, and the rest of the bile will stored, and when it is necessary, a little amount of bile will come to the intestine for digestion and absorption of the fat molecules. Okay, so the today's lecture is name of the biliary apparatus. That means the substance which is involved in biliary channels. So here you can see the liver, and there are a lot of biliary little channels which reunited to form the biliary system. So first of all, the biliary apparatus of the liver has two parts. One that is intrahepatic part, and another portion is extrahepatic part. It means that passage through the hepatic bile and the gallbladder bile must be sent to the second part of the duodenum. That means liver bile and the gallbladder bile must send to the second part of the small intestine. So intrahepatic biliary part starts from the bile canaliculi, which is the part of the hepatic sinusoids. In the previous class I already told you that in between numerous hepatocytes there are greenish little cell which produce bile, which is called a bile canaliculi. From that bile canaliculi, that bile will come as a canal of herring, then bile ductules, then ultimately it will form the right and left hepatic duct. So it will divided into bile ductule, small ductules, which is the unit of the each and every hepatic sinusoid that will produce bile, which will reunited in the bile ductule, which is situated in the interlobar space. Then it will go through as a right and left bile duct. Then these two bile duct will form a common hepatic duct. That means it is a common. Two duct makes a common hepatic duct. Then it will reunite it with the cystic duct. So this is the gallbladder. It is the primary storage of the bile. When the liver will produce bile a lot, it is more about 1000 to 1500 ml of bile that will produce from the liver each day, and a portion of the liver will produce a bile that will stored in the gallbladder. Okay, that will stored in the gallbladder, and that bile will make concentrated and stored, and which will reduce alkalinity. Then it will go through the cystic duct. This is the cystic duct, then which will reunite it with the common hepatic duct and form a single channel which goes posterior to the first part of the duodenum, and ultimately it enters into the pancreas and then ultimately drained in the small intestine. So this is called the common bile duct. So this is the right and left hepatic duct, common hepatic duct, then common bile duct. So common bile duct which starts after reunition of the cystic duct and common hepatic duct, and it will enter into the second part of the duodenum. Before that, the most of the people will encounter that pancreatic duct. There is a pancreas, a big organ. I will discuss in the next lecture that these pancreas has the main pancreatic duct and accessory pancreatic duct. So main pancreatic duct will reunite it with the common bile duct and forms ampulla vata that will open into second part of the duodenum in the major duodenal papilla, where it is, see, it's like the posteromedially. So main pancreatic duct or major present, or the ampulla vata present in the major duodenal papilla. So in the duodenal class I already told you that there are two major duodenal papilla, one major duodenal papilla, one is a minor duodenal papilla. So in between two foramen there is a 2 centimeter gap. So first minor duodenal papilla, then after 2 centimeter below it has a space, a major duodenal papilla, where ampulla vata or the pancreatic duct and the bile duct is opened in the major duodenal papilla, okay, of this second part of the duodenum. So here this is the main things from here to here, okay. So if we can see so much microstructure, so it looks like that common bile duct comes and the pancreatic duct also reunited here and forms a dilated portion which is called the ampulla vata, enters into the second part of the duodenum. His direction is like posterior-medially, okay. Sometimes in the exam comes in this kind of question that what is the direction of ampulla vata or opening? The answer will be posterior-medially. These two ducts opened posterior-medially of the intestine. Okay, so let's discuss about it. First, this is the extrahepatic biliary channels. I already discussed about the intrahepatic duct. Now what are the extrahepatic part of the biliary apparatus duct? So what I told you, gallbladder along with cystic duct, right and left common hepatic duct, common bile duct, up to the ampulla vata. So this whole portion consists of extrahepatic part of the bile biliary channel. Okay, now a brief discussion about the single portion, that is the common hepatic duct. First, this is the common hepatic duct which is about 3 centimeter long. So it is long about 3 centimeter and 4 millimeter in caliber. That means the diameter will be 4 millimeter and the long, that is the length will be 3 centimeter. So what are the structures surrounding or the presence surround of the common hepatic duct? So from behind forwards you have to describe like this. From behind forward, portal vein, that is the blue color, you can see the blue color vessels which lies posterior to the common hepatic duct and which is called the portal vein. Then principal hepatic artery. So this is the hepatic artery which will give 20% supply to the liver. So from behind forwards, first portal vein, then hepatic artery, and then the cystic duct. Okay, so behind forward, portal vein, hepatic duct, hepatic artery, and the common hepatic duct. Okay, now the gallbladder. So this is the gallbladder. It is a pear-shaped organ which is like here, as a color of bile is greenish, so author makes the drawing as a green color. So in some book you will see that color of the gallbladder is bluish in color. As in the normal anatomy, it is also look like blue color. So here, to identify or to make it different from the vein, the author write down the gallbladder color in the green. Okay, but actually in the normal human body, these gallbladders look like blue in color, and they situated in the gallbladder fossa. So in the inferior surface of the liver, or the visceral surface of the liver has a non-peritoneal area where the gallbladder presents. So gallbladder is usually present in the gallbladder fossa, which is non-peritoneal. Okay, the rest of the portion is peritoneal. And the length of the gallbladder is about 7 to 10 centimeter. Okay, because it varies according to the race of the people. The Asian people is usually 5 to 7, but in the Caucasian, African or other region, other ratio peoples, they will possess like 7 to 10 centimeter. And what is the capacity? So capacity is like 30 to 50 ml, which is also discussed in the physiology. So let's see, this is the gallbladder cross section. You can see the pear-shaped organ, which is about 7 to 10 centimeter, and breadth is about 3 centimeter, capacity 30 to 50 ml. So 30 to 50 ml of bile will stored as in the gallbladder. So what are the parts? So you can see from upward to backward. So this is upward to backward. Okay, upward to backward. You will say the fundus, body, neck. Okay, so upward to backward, fundus, body and neck. Okay, so now the discussion about the fundus. So this is the fundus. The tip of the gallbladder possesses a fundus, or the lower part of the gallbladder, which is lies along this 9 costal cartilage. Okay, it will this is the right colic flexure or hepatic flexure, and the left side the pyloric part of the stomach. So this is the pyloric part of the stomach present in the left side. Okay, neck is edge shaped. So here it is S-shaped organ, carved, which is carved. Okay, carved S-shaped organ. Which is downward, directed downward and backward. So it gives downward and backward. Sometimes in the neck of the portion gives a small diverticulum known as the Hartmann pouch. Sorry to interruptions. Okay, so the neck portion is somehow spiral or folded. You can see the multiple spiral portion here in the spiral, the neck, which is H-shaped, carved and spiral. Okay, contains smooth muscles, and the small, in some type of gallbladder, contains a pouch which is called the Hartmann pouch in the neck. Some people has the diverticulum or the pouch like structures present in the neck of the gallbladder, which is some like this. You can see here a pouch like things. Then the rest of the portion is called the cystic duct. So after the neck, the cystic duct begins. Not all the people have the Hartmann pouch. Some people contains the Hartmann pouch. It is physiological, it has no other abnormality, but if the stone occurs, sometimes a big stone will stuck in the neck of the gallbladder and forms the obstruction of the biliary pathway that will form infections or other inflammatory conditions. Now the histological structure of the gallbladder. You can see some, this is the wall histological structures. For inward to outward, you can see there's some tall columnar epithelium, because the lining of the epithelium is a simple columnar epithelium which is tall. These columnar epithelium is slightly taller and becomes rugosity internally. So the epithelium of the, or the surface epithelium of the gallbladder becomes ruguous or rugosity present on the folded, multiple section and folded present in the inner surface. There are some abnormalities or the peculiarities present in the gallbladder, because in the gallbladder there is no submucosa coat. Like tall columnar epithelium, then lamina propria muscularis mucosae. Here there is no muscularis mucosae. So mucus layer contains an absence of muscularis mucosae. Then the muscular layer, then the serous layer. So you can see the gallbladder has no submucous coat. Even there is no other gland present in the gallbladder, because gallbladder function is very much storing functions. There is no absorption, a slight secretion of water or watery substances. Like there are other cells present in the mucous membrane, like the pencil cells, like the basal cells, and the numerous villous structure. These villi or rugosity will increase the surface area, free surface area, and also the attached surface area. So it will increase the absorption. So, in case of some bile must be absorbed in the wall and resecreted into the lumen. By this way bile become concentrated, and reduction of the alkalinity of the liver bile, because liver bile is so much alkaline that will stored in the gallbladder and become concentrated. Then when it is necessary, that gallbladder become contracted and the liver will go to the second part of the duodenum. Now the Callous triangle, So after the relationship around the neck, you must know the triangle, or there is a clinical importance regarding here, that is called the Callous Triangle. There is a triangular area bounded by medially common hepatic duct, and inferolaterally, that is a cystic duct, and the anterosuperiorly, that is liver, inferior surface of the liver, which is bounded this triangle, which is called the Callous Triangle. So what are the content of the Callous Triangle? Callous Triangle contains the cystic artery, which comes from the right hepatic artery, cystic vein, and some loose areolar tissue and the lymphatics. So this is a loose artery along with this lymphatics. These things is very important, because surgically when the cholecystectomy occurs or the removal of the gallbladder occurs, this cystic duct is identified and the cystic artery vein is blocked and clipped. Then this portion of the cystic duct must be ligated, then the removal of the gallbladder occurs. So for surgical importance or clinical important, this Callous Triangle is very much necessary for identification of the cystic artery and vein, along with sublymphatic and lymph nodes also present. It is called the Lund, lymph node of Lund, or cholecystohepatic lymph node. Okay. Now the next part. Now the artery supply of the gallbladder. Gallbladder is supplied by the cystic artery. You can see a long artery which is derived from the right hepatic artery. So this is the common hepatic artery that will divide it into right and left hepatic artery. So gallbladder is supplied by mainly from the right hepatic artery. So it is the right hepatic artery and this is the cystic artery. So cystic artery is the main branch of gallbladder, and the venous drainage is the cystic vein. That means here it is the portal vein, the largest venous drainage or portal system of the human body, that is liver portal system. So cystic vein will derive from the portal vein. Okay, and the that is right branch of portal vein. So this is the right branch, this is the left branch. So cystic vein will come from the right branch of portal vein. Now the cystic duct, here it is the cystic duct, because cystic duct will connect the gallbladder with the common hepatic duct. So its length is about 3 to 4 centimeter and 2 centimeter in breadth. Now this cystic duct contains 5 to 12 fold or section. This fold will act as a valve, which is called the valve of Heister. So cystic duct have a valve, it's called the valve of Heister. It is nothing but 5 to 12 fold of wall. So, and what are the organ related? So surrounding these structures, what is the present? Behind the portal vein, you can see the portal vein, medially common hepatic duct. So medially in the common hepatic duct, posteriorly portal vein, and the above and laterally cystic artery. So above and laterally cystic artery. So you can see the portal vein lies posteriorly, above and laterally cystic artery, and the medially common hepatic duct. So in this lecture, relation is very much important, because teachers is usually ask the relationship and the connection, pathways. This will very important. So you can see the common hepatic duct become common bile duct or the bile duct. Okay, it is about 15 centimeter, 8 to 16 centimeter in length, and which is started from the cystic duct and the common hepatic duct reunited from the common bile duct. It has 4 parts, that is supraduodenal portion, retroduodenal portion. You can see the posterior to the part of the bile duct, you can see another portion is called the retroduodenal portion. So it is the supraduodenal, this part is a retroduodenal, this part is infraduodenal, and the rest of the portion that will enter into the ampulla beta, that is called intraduodenal. So these are the 4 part of the common bile duct. Now you can see there is a yellow structure is called the main pancreatic duct. Main pancreatic duct will reunite it with the common bile duct and forms ampulla beta and part of the and drained in the major duodenal papilla, that is the second part of the duodenum. But in 30% cases these 2 ducts become separated. These 2 ducts can be opened in the second part of the duodenum in the separate way, not in the reunited form. Now this portion of the bile duct will supplied by gastroduodenal artery, that is posterior superior pancreaticoduodenal and posterior inferior pancreaticoduodenal artery. So that will be discussed later. So from which this artery conforms and which area this artery will give supply. Okay, so now the development. So liver and the biliary tract will develop from the same region. It will first develop in the 4th week of intrauterine life, which is derived from endoderm, and the fibrous portion of the liver, that is the bare area, the coronary ligaments, the other system, that is upper portion, all will develop from the fibrous stroma of the septum transversum. That means the fibrous portion of the liver will develop from the septum transversum, and the glandular portion along with the extra and intrahepatic biliary channel will develop from endoderm. Okay, so that is the main things. Now in the next class we will discuss about the pancreas, the next organ present in this area. I hope you will have the opportunity to see this lecture and the other lectures, and I hope you will enjoy this class and stay connected so that you can have a good anatomical knowledge, and as well as the good exam scores that will establish all over the world, along with in our country also. Thank you very much for patient hearing. Thank you for watching.